For more on how people are preparing for the new school year, we've invited Sophie Hargest and Nicholas Seles onto the program. Sophie is a mother of 2 students, and she joins us now from Ottawa. And Nicholas is a journalism student going into his final year at Humber College, and he joins us from Brampton, Ontario. Welcome to you both. Thanks for joining us.
Hi, Hillary. Thank you.
Hi, thanks for having us.
So, Nicholas, I want to start with you. We're heading into a 4th wave. Wondering what are your concerns about returning back to school?
Well, the big concern, obviously, is while it's great to be there in person again and kind of get back to the old routine and old habits, you're on high alert, basically, because you don't want to be part of the issue with spreading COVID-19, especially with the variants now raging through. And, you know, you don't know what all of your classmates' vaccination status is, if at all. And, you know, you don't want to get lost in just being able to be back on campus and be in person and let your guard down.
And Sophie, you're a mom of 2 students. How old are they, first of all?
They're youth. They're 17 and 18.
So 17 and 18. So they could both be vaccinated then. But wondering what are you most concerned about?
Well, definitely I'm concerned about contracting COVID. I think my kids are both still in high school, and I'm very concerned about ensuring that everyone is adequately protected and masked for sure in those learning spaces. It is ramping up, and I think it's more devastating for youth to be starting and stopping and starting and stopping all the time, as opposed to just having a solid mandate. We're going back to school, and these are the precautions that we're going to be taking.
And Nicholas, you mentioned that you're concerned about your peers and whether or not they are vaccinated. There's also benefits to seeing classmates in person. So how important is it that kind of human interaction, that's able to continue this school year, particularly for your mental health?
Oh, it's huge for mental health. My second year last year was completely online. And even the final few weeks of my first year was all online. And, the novelty of being at home and being able to, sleep in and just kind of roll over and open your laptop and you're in class, that wore off really quickly for me. And it was, being able to see people in person every day, talk to them. My professors might hate me for saying this, but, not pay attention and slack off and chit chat. That plays a huge part in just kind of helping you get through the day rather than staring at a laptop screen for 7, 8 or more hours. So it's hugely important, I think. And a lot of people in my class, I know, were feeling the strain of not seeing each other.
And Nicholas, talk to me about this concern that you have about whether or not people that you're with in class might be vaccinated.
I know it's up to the individual if they want to get vaccinated, and I'm by no means am one of the people that are forcing it. Obviously, it's preferred, in my opinion, just to try and help stop the spread and be as much of a burden on the healthcare system as it's been. But just in terms of people's health and safety, it's hugely important. My mom is immunocompromised, so I try to be as careful as I can with what I bring home and bring to the house. And she's limited to where she goes and what she does. So for me personally, it comes down to protecting myself and the people in my house that I love. And obviously, I want my classmates and my friends to be safe as much as they can.
And Sophie, you're a mom of 2 teens. What type of toll has this taken, the pandemic, on their mental health? Is there anything that you've noticed about them over the past year and a half?
Oh, sure. I mean, they're pretty checked out, largely from socializing and from engaging. Their attention spans generally are a lot shorter. Their moods are low. Their anxiety is a lot higher, my sons in particular. The fact is that, you can't live in a home for this amount of time without kind of interaction with other people, socializing, without this having effect. My children both also have special needs, and, the difficulty of coming, Nicholas referred to basically kind of an erosion of habits, right? That having to get up every day on schedule and kind of losing just rolling over in bed and kind of checking into school kind of loses its novelty. Well, absolutely, I think, but there's also an erosion of functioning that happens around that too, right? So we've got a whole whack of kids across the country going back to school who are out of habits, maybe not study habits. They've been checking in with school. But I mean, I think we're kind of kidding ourselves if we think that our kids have been performing at the same level that they did before. And moving back into a school space, you know, where there isn't kind of a gradual reintroduction to that space is really challenging, I think, for most kids. And so for me, yeah, I think it's going to take, their mental health is going to take a bit of a hit too, going back. You know, I mean, socialization skills, anxiety, meeting friends they haven't seen for a while. And when you've got a kid who's got anxiety, they've also done the whole gymnastics in their head about the worst case scenarios with COVID, right? For my son in particular, I just sort of kept him in the house the whole time. He stopped hanging out with his friends because he was, you know, following the media and you know, the reality of the fearfulness of it. You know, we've lost people that we know to COVID. We're vaccinated. It doesn't matter. You know, the fact is we can still contract it, but just to a lesser degree. They're anxious. They're worried.
So we just have a couple of minutes left here. So final question to both of you. What changes would you both like to see to support students right now? And Sophie, let's start with you.
Yeah, I think that, you know, pre-pandemic, we had an incredible crisis in this country with respect to youth mental health. We had an absolute lack of resources, and I think we're heading into a much worse period of time. We've seen the erosion of mental health in our youth throughout this pandemic. It's worse. I think people are dealing with more anxiety, not less, as they go back to school. I think that we need to be seeing governments, you know, frankly, pouring resources into the schools in terms of extra social work, psychological support, youth workers, to support and bolster the teachers who are professionals in their own right. But I mean, they have limited capacity in terms of their classrooms. And so I think a lot of kids are going to be left on the sidelines. I mean, there are those kids that come from great families and, you know, lots of support, but there are those who've been struggling with families in crisis through this period, you know, due to hardship and everything else. And the fact is, you got a lot of kids that are coming back that are going to be looking forward to being back in school, but who are going to be struggling and need that extra support outside of their homes. And
Nicholas, just quickly, what's the number one thing you'd like to see for students right now?
I think an equal balance of the choice, I would say, between going to class or having it online rather than strictly one or the other. That might, you know, be a good balance, because then you can kind of pick and choose how you get your education without sacrificing anything.
Okay, well, thank you so much to both of you for coming on the program today, and best of luck with back to school.